How's it, and welcome back to my channel. Today we are going to be doing heart attacks. So we'll be following the format approach, which is why, what, how, and if. So the first question is why. I've spent quite a bit of time thinking about why heart attack and I can't answer it. So we're going to go to what. What is a heart attack? So many people think that a heart attack is when you go, oh, pain in my chest, and collapse. This is not necessarily a heart attack. That's when your heart stops. So a heart attack is really a blockage in the blood getting to the heart muscle. So all muscle needs blood, and therefore when there is either a restriction of how much blood is getting to the heart, or when there's a complete blockage of blood to the heart, it really comes down to a supply and demand. If there is too much demand on the heart and there's too little supply, you have a heart attack, whether it's small or big. So that's what is a heart attack. So how would you know someone is having a heart attack? Well, what happens is that you have typical signs and symptoms. So things that you can see and things that you can be told. Typical signs and symptoms of a heart attack. So things that you can see or things that the patient or person can tell you is they have chest pain in the center of their chest. They have a numbness going down the left arm. They might have a history of smoking or diabetes or high blood pressure, or maybe they've had chest pain previously and it's now gotten worse over time. Those would be typical signs of a heart attack. They will be pale, so they'll be looking like whitish. They'll be sweaty. They'll most likely have really bad pain. That would be a typical heart attack. I've had heart attacks where the only complaint was lower back pain and the lady was still having a heart attack. So the other point to mention is that sometimes someone will have chest pain, and then when they stop exerting themselves, so they decrease the demand on the heart, the chest pain goes away. So that is known as an angina, which is meaning chest pain. It's a Greek or something word that means chest pain. And what that means is if they have stable angina, it means that while they have exertion, so if they're walking upstairs or playing sports and they have chest pain, and then they stop playing sport or stop walking up the stairs and the chest pain goes away, that would be considered stable angina. This person should still get checked out. There's probably something still wrong, and they need to go and see a doctor to have a look at that. So how would you treat a heart attack? So a heart attack is very complex. There's lots of things that doctors can do. There's lots of medications that can be done. Someone can get a stent, or someone can have a very powerful drug pushed through their vein and it can clear out the blockages and all that sort of thing. You as a first aider, what you need to do is you need to be calm and you need to help the patient be calm. If they're stressed, they're running on more adrenaline. More adrenaline means more demand on the heart, and that means there is not enough supply and there's too much demand and you're causing a worse problem. As a first aider, I don't know whether you are allowed to give aspirin, but that is the drug of choice. As paramedics, we give aspirin as a first aider. If you're allowed to in your country, you give aspirin. It's 300 milligrams in my country. Just make sure that you're not breaking any laws. I'm not giving you permission to give this, but it is the life-saving drug to give. And then what is also really important is to work out the time that the chest pain started. If they've had chest pain for days and weeks and months, it's most likely not a heart attack. If they've had chest pain for the last hour, half an hour, 2-3 hours, and it's central, it's radiating, it could very well be a heart attack, and that needs to be taken very seriously. So if you are with someone and they get chest pain, or you come across someone who has chest pain, it doesn't have to be radiating, it doesn't have to have central chest pain. All of these signs aren't always there, but those are the typical signs. What you're going to do is you're going to hazards, hello, help, ABC. Remember, always call for help, always check what's actually happening with the patient. They're breathing all right, they have a pulse because they're talking to you. You're going to call for help, and you're going to calm them down, you're going to reassure them, and you're going to stay with them until help gets there. And then remember, the aspirin is, if you have aspirin, if you're allowed to give aspirin, just check the laws in your country. But if you don't give it, the paramedics who get there will most likely give it, because that is a life-saving medication. Thanks for watching. Remember that there will be a quiz at the bottom, and there will be a review or a feedback form at the bottom as well. It really helps me. The quiz is there for you to help you learn, and the feedback is there for me, so help me learn. Thanks for watching.